Welcome to the Hunter New England Central Coast Primary Care Quality Improvement Community of Practice this evening. Our webinar will be on telehealth and how to use it effectively as a tool in this practice environment. Firstly, I'd like to acknowledge the first custodians of our land at which we're meeting this evening and honour elders past, present and emerging. My name is Mel Wilkinson. I'm from the education team at PHN. Just noting before we start, we have a quality improvement community of practice at the PHN, and that's Kate Dickelstad who's with us this evening. Hi, Kate. She'll be facilitating. She's one of our quality improvement managers at the PHN. If you'd like to access this, please contact Kate either by email or phone, and she'll be able to give you information on how you can apply to access the resources and discussions in that community. The details will be up on the screen in just a moment.
I'll take over there and just switch the screen across, so bear with me. Okay, so you should be able to see the Primary Care Quality Improvement Community of Practice. I'm getting nods from my colleagues. So I'm the Quality Improvement Manager at the PHN. This is a piece of work that's been developed by many people within the PHN. It has a whole lot of information in here that you in your practice can just pick up and run with if you choose to do quality improvement in these particular areas. So we've got just an overview in terms of reference for the site. Then we've got tools to use when starting QI in your practice. So that's got a fundamentals document, which essentially takes you through the steps of how to run a quality improvement activity in your practice. We've got the webinar series, which is what we're doing tonight. So this is the first webinar in 2021, and we've got 10 throughout the year. So we run them from February through to November. We have a few different QI projects specific to different areas in the organisation. One of those is Lumos, so we have some information in there about those QI projects. We have MFI examples, and Hannah's going to take you through, sorry, MFI means Model for Improvement, which is the framework we use for quality improvement at the PHN. Hannah's going to take you through one of those, and you'll meet Hannah in a minute. And there I've just shown you what's in that folder. There's a whole lot of examples of quality improvement activities that you can print off and implement straight away. And I've got a visitor, excuse the visitor in the background. So you can print off and use these straight away if you choose to. Please don't talk. So just going back home, we've got QI resources in lots of different clinical areas that you can use. So there's a couple of different options in the health assessments. You've got a 75+ health assessment QI toolkit and also a 45 to 49 QI toolkit in there. I'm not going to take up any more time talking about this. I'm going to hand back to Mel in a second. There's also a chat thread that I try and put up resources for you to have a look at that's relevant to your practice. So that's it from me. I'll hand back to Mel. Thanks.
Thanks, Kate. I'd just like to remind everyone to please regularly refer to the health pathways. They are regularly kept up to date, and those pathways are an amazing resource with several telehealth pathways available, and they're incredibly useful and there to be utilised, so take advantage of that. I'd like to now go back to our website content. Our facilitator today, or tonight, sorry, is Hannah Lane. She's one of our PHN's project officers supporting a couple of projects in-house. We're keeping her very busy. Hannah has over 20 years experience managing strategic projects, engaging events, communications and contracts for executive leaders in the transport, finance and health sectors in Sydney and in London. This is just amazing experience there. The qualifications include a Bachelor of Commerce and a Master of Business Law. Hannah moved to the New England region in 2020, joining the PHN to our benefit for the COVID-19 response team in July 2020. She works on key projects in the PHN, and we're very lucky to have her with us tonight. So number one of those projects would be the Capacity Tracker, which is a free online system that enables general practice and residential aged care facilities to make real-time updates to the PHN on the PPE supplies, operational capacity and reducing and resourcing status, and also telehealth, which we're going to talk about this evening, specifically supporting GPs, Aboriginal medical services, allied health professionals and residential aged care facilities to implement video consultation and their businesses. Hannah facilitates the delivery and implementation of federally funded Health Direct video calls. It's a perfect person to advise us tonight on this by providing one-on-one demonstrations, resources and support to current and potential users. Today, Hannah will share with us the merits of using video consultation, the features and functionalities of Health Direct video calls, and the resources, tools to support available to help you to get started with your video consultations. We can also look tonight at how telehealth can be used in a QI activity, which you can use in your practice and for PIP purposes. In terms of asking questions, I'd ask you to refer to the chat box in the control panel as we go along. We'd like this to be as interactive as possible and we welcome your questions. If we don't get to those questions, I can always forward those to Hannah later on and we'll endeavour to get back to you via email, which is always a great resource. Just a reminder to mute yourself on the mic. We've had some interesting interactions with people not doing that, so I strongly encourage you to do that, please, this evening. That would be amazing. There will be a survey at the end of the webinar, so please do fill that in. We value your input and helps us, with further education sessions that we can get true feedback and make it as valuable for you as we can. And on that note, I'm going to hand over to Hannah. Thank you, Hannah. Over to you.
Thanks very much, Mel. That was quite an introduction, so I hope I live up to expectations. Thank you everyone for joining us. I'd like to just start by saying the objectives for this session as I see them is to share with you about the PHN Telehealth project, which aims to increase the use of video consultation among GPs, Aboriginal medical services, allied health professionals and residential aged care facilities. So tonight we're going to look at, as Mel said, the merits of offering video consultation to patients, the Health Direct video call tool, the model for improvement framework, and what support and resources are available if you're embedding video consultation in your practice. Okay, so starting firstly with why offer video consultation to patients. There's two areas if you look at them from the clinician perspective and the patient perspective. For clinicians, there's a comprehensive service offering and it's an extension to the services already provided. It's also the most closely replicable to a face-to-face experience if it's not available. There's the flexibility of being able to provide a service from any location and at any time. There's obviously cost savings and there's the ability to service a broader network of patients across a larger geographic area. For patients, obviously there's a lot of cost savings in potential travel, tolls, parking, accommodation and so on. It's often much more convenient for patients to be able to attend a consultation in the time and place that suits them. There's greater continuity of care and easier access to clinicians, and it's often easier to include different local health professionals or specialists, even translators in need, perhaps a carer as well. So different parties can be brought in as they're required. This is a quote from someone who contributed to the Australia's Health Panel survey. And it's just to show you the benefits as they reported, being more relaxed, feeling more confident in a more familiar environment and more at ease, not having stress that this person cares for 2 people and was facing a 90-minute drive to a city hospital. So there were cost savings, there were time savings. They didn't have to turn down work for the entire day, and the summary was that the benefits of telehealth are immense. So then the question becomes, why offer video before telephone consultation? In essence, it offers a better patient experience. It's more comprehensive than telephone consultation. It gives that visual examination option as well as audio input. That enables the practitioner to determine whether the patient is understanding the information and the instructions that are provided. And it also minimises the risk that the clinician overlooks something important when they're assessing the patient. The other important factor is that The MBS online guidance states that video consultation services are the preferred approach when face-to-face is not available. So audio only, so telephone is given as an option, but it is made very clear that video is the preference. So in order to avoid breaching the MBS guidelines and any associated risks of that, it's recommended that you use video consultation, or at least offer it as a first option to your patients. Those who can't use it for any reason can, of course, request a telephone or a face-to-face consultation instead. So then, if you're thinking about how you might go about implementing video consultation, there's obviously a lot to think through in terms of what system you should use. Now, Kate did encourage me to make very clear that you're not expected to be able to read this, but this is just to show you that the PHN has put together a summary, essentially, of 16 different commonly used video consultation systems that we can share with you or use to compare what you're currently using with Health Direct Video Call, which we'll talk about next. As you can see from the colours though, there's different strengths and weaknesses to each one, and this little summary will go through the different functions and features, the costs, and particularly items that relate to a medical or health context. And so as you see, where the red one, where there's a lot of red, it's indicative of generally available systems that are not specifically designed for health and for privacy requirements. So there's also elements of privacy and security that we can consider when we look at what you are using or what you would like to use. So the PHN supports this product called Health Direct Video Call. I'm going to talk you through some of the key features on that now. The first important thing to note is that there's strong privacy, security and compliance requirements to be met by any system that is being used for health consultations, and Health Direct Video Call complies with these Australian Information Commissioner requirements. It is encrypted from end to end, and it's good at managing privacy. It's also funded by the federal government, so you can have assurance in the product. This product is actually specifically designed for virtual health consultations, so it does closely replicate face-to-face visits. For patients, it's very simple. There's just one link to click, and that can be sent by email or by text message, and it can also be included in an invitation, a meeting invitation if your clinical software sends appointments. There is a virtual waiting room, so just as there is a real waiting room, there's a virtual one where the practitioner collects the patient as they would ordinarily in a face-to-face consultation, and the management and administration is quite straightforward. You can have up to 5 people in a consultation, so as I mentioned before, there might be other health professionals, translators, family members and so on. And there's various functions to enable sharing of screens, sharing of files, drawing, annotating and so on, which I will show you later. In terms of technical requirements, there is a requirement to use a certain browser, which I'll come to in a moment, but patients don't need an account, any special software, any dial-in details or anything like that, and you can access Health Direct Video Call from computers, laptops, tablets and mobiles. Finally, there's extensive support online, so there's training videos, there's step-by-step guides, there's even a help desk that you can contact by phone and email, and the PHN also provides support for setup and onboarding onto Health Direct Video Call. So this gives you an outline of the browser requirements. In general, it's using Google Chrome. The Safari browser is the one to use if you're using a Mac. So this is what it looks like for a practitioner. It's a very simple sign-in. As you can see, there's an option to sign in for today. So that means you don't have to sign in repeatedly if you're using it at different times throughout the day, and it's just an email and a password to enter. And obviously I should say you choose the password and it's the email that you nominate. So once you log in through that main screen, you arrive in the waiting room. So as you can see in this example, there are 2 patients waiting. One has been waiting almost 3 minutes and one has been waiting almost 2 minutes. You can see the telephone numbers and you're able to join the call when you are ready, or to notify them. So you might use this function to say to them, for example, that the doctor is running 5 minutes late and will be with them shortly. You can notify them as many times as you require over the duration. So this is what it looks like when a consultation is begun. So you always see the other person in the larger window. And then you have a range of available tools here. So as you can see, you can share images, screen share, whiteboard, take photos, and so on. Here's an example of sharing an image. And using these tools, you can actually type letters, or you can circle, you can mark certain points with markers, and you can even rotate and zoom in and so on. When the consultation ends, you have two options. You can either leave the call, and as you see there, only you leave the call, which means that if that person needs to see another practitioner in your practice, they go back to the waiting room. Otherwise, you can end the call, and that means it's ended for all participants, and that's the end of the consultation for the patient and for you. So let's look at some of the benefits of choosing Health Direct Video Call. The first one is that it's federally funded until the end of March 2021 for general practitioners that are in private practice and for the Aboriginal community controlled health services. And it's also free to use for allied health professionals until June 2021. So it's a great opportunity to try it out, see how your patients like it, see how it works for you. It's also very easy to use, as you've seen. It's the one link for patients. It's a simple and easy to use waiting room and easy to communicate with your patients. There's all the education, support and training available from Health Direct. There's the guidance from the PHN, which I'll come to in a moment, and it is secure and private. So that gives you assurance that you are using a product that is appropriate for the type of work you're doing. So we'll look at quality improvement now. The first stage of this is looking at goal setting and considering what you're trying to accomplish. If you use this as if you want to apply the model for improvement framework and use telehealth as a project essentially. So the three questions that we look at are, what are we trying to accomplish? How will we know that a change is an improvement? And what changes can we make that lead to an improvement? So as we think through those things, we develop essentially this little template on the left, which is our example that we're going to work through this evening. As you can see, we say make one PDSA for each of the ideas you identify. So there's 4 ideas identified on the left here, and we encourage you to make these ideas small so that we can work through and test each of them individually. We'll go through then the PDSA cycle, so that's plan, do, study and act. And we'll look at that next. So once we've answered these questions and we've drawn up a bit of a goal to work through, we then look at the model for improvement framework. So as I mentioned, we've got the plan, do, study and act, the 4 components, and we're taking this idea that we want to educate patients on how to use video consultation. So in order to do that, we're going to think through these elements. Who are we looking at doing the educating, and who are our patients? How and when and where are we going to do this work? What do we think might be the outcomes? What data will be collected? Then we consider, okay, was the plan executed? Were there any unexpected events or problems? Have we recorded the data? Then what does the action and the data show? So when we look at the results, how do they compare to predictions? And then finally, what will we take forward? What's the next step or cycle? So as I said, just remember to keep it small so that we can look at each of the individual factors that can influence this, these outcomes. So to walk through it in more detail, so planning, we're looking at identifying what to do. So you might identify that to educate the patients in using telehealth, it's going to be a job for the practice manager and their team. We're going to determine a start date. It's going to be done in and through the general practice. And then there might be 3 data components. So perhaps a report that shows the number of telehealth consultations that were billed last month and what percentage they are of your total billings, and then how that percentage compares to, say, telephone items or face-to-face. So I've just put a tip down there as well. Our PCIO team has developed a practice manager's toolkit that you can access through the community of practice. That includes financial tools, templates, and calculators. That part is available through the PCIOs, and these things can help you to calculate the potential impact and savings of introducing video consultation into your practice. So if you'd like to find out more about that, contact Kate. That can inform, obviously, your first step. Then you look at what you might do. So focusing on educating your patients. So here are some ideas. You might develop a sales pitch to encourage the patients to use video consultation. So telling them about the merits and the benefits for them. You might determine some kind of checklist that helps you to think through, is this patient capable of using video consultation? So perhaps it involves asking questions about the mobile phone they have, or whether they have access to a computer on the internet, and so on. You would validate the patient's email and phone number. You could train your staff members to help the patients use video consultation. And so, for example, if you're using Health Direct, you can all read the watch the Health Direct training video. There's a 5-minute summary, and then you can dip into the help as required to make sure that all your staff know how to use it and can then advise patients if they have any questions. You can give a patient checklist out, and you can also provide some brochures and education material either in person in hard copy or on your website, even on your social media. So I've put a note there. Many of these resources are available from the Telehealth webpage, so that's the address there. And here are some more examples. So we drew up some specifics. First practical tip is to tell your patients that you're offering video consultation. Tell them what services are available via video consultation, and just embed that and make that a habit at the end of each of the consultations that you have. Book any follow-up appointments via video consultation first and foremost, providing that it's suitable for the type of consultation and that the patient consents. You can actually embed a telehealth video call button on your practice website, and the link is there. You can share the video guides with the patients and the practitioners, so they're available freely and publicly accessible. You can put up posters and signage. You can hand out wallet cards so that they can have your contact details and the information about booking video consultation with them. And you can even record an audio message if you've got some kind of phone message or social media channel. Something as simple as just saying, did you know that if you've seen a GP in our practice face-to-face within the last 12 months, you can have a telehealth consultation no matter where you are. And you can give your website address and give the phone number of the practice if need be, and encourage people to make an appointment that way. So those are some practical tips. The next step, the third step, is to study, to analyse the data and results. So you've done the planning, you've applied the planning, and now we're looking at what are the results of the test. So essentially we're reviewing the report data for the trial period and looking at whether there's been any increased usage. So have any of these activities or interventions made a difference in the uptake of video consultation among your patients, or at least the awareness? So what you might do is compare how many people were seen by video consultation, how many people were seen by telephone or face-to-face, and look for any trends. So is there any theme or trend in terms of who provided the service? Maybe some practitioners are more confident than others, or need some help with additional resources. Perhaps there's certain days or times when video consultation seems to work better than others. Potentially there's issues with patient mobility or hearing or capability in some way, and maybe they're not as comfortable with technology. So there's different aspects to think through and analyse as you look at this information. The final point there is It's important to talk to your patients as well about their openness to video consultation and also their experience of it. So get qualitative and quantitative information and review that. The patients can almost certainly give you a great insight into why they may or may not have used video consultation, and there are ways that you might be able to improve your service by addressing their points. So on that note, the PHN Telehealth webpage, it's the Telehealth FAQs for frequently asked questions. Now, that was developed based on an RACP report of quotes from practitioners discussing some of the obstacles and barriers that they encountered when they were introducing video consultation. So there's many positive comments as well, but what we did was try and identify, well, how can we overcome these obstacles and make it as accessible as possible to as many people as possible. So I really strongly encourage you to go and have a look at that. And so when you come up against some questions that might be challenging, so it could be anything from, I don't know if my internet is sufficiently fast enough to be able to do a video consultation successfully, there's an answer that will help you to address that question, or dealing with different types of patients, or whether you can have translators and so on. There's a really broad range of questions on that page. Finally, ACT. So the fourth step is, now that you've got your results and you're reviewing those with the practice team, is there any additional data that you might need? What has worked well? What else could be improved? And how could further gains be made? So are there additional things you can introduce? And if so, you develop a new cycle. So another sort of succinct, small, manageable task, and you develop a plan, do, study, act cycle for that. However, if you think there really is nothing further that could be changed or adapted, move on to the next project. So I've just put in the tip there. There's a lot more quality improvement training resources, videos and example activities for you to access in the PHN Quality Improvement and Quality Improvement Community of Practice websites as well. So do check out those links. So support and next steps. If you are thinking about the merits of introducing or really reviving video consultation in your practice, let me talk you through some of the ways we can help. The first thing is that we'll provide free advice for you. We can help you to work out how to offer video consultation to your patients. We'll do the setup and the initial administration for you, even helping you source the right IT equipment if need be. We do one-to-one demonstrations, so we will give you a personal walkthrough of the video call system at a time that suits you. We can share with you a one-page guide to embedding video consultation, so that makes it just a little simpler for thinking through what needs to be done and what needs to change in your practice to introduce this. And then we're here to help on an ongoing basis if you need any additional guidance or have further questions. So where to from here? This is my little roadmap. Essentially, if you're interested in understanding more about video consultation or telehealth in general, or you have any questions, get in touch with us. Either email the address that's shown on the screen there, or make a note in the session evaluation, or put a question in the chat box even as we speak. We'll then show you how these different video consultation systems compare on features, costs, privacy and security, which is that spreadsheet I showed you earlier, but in a much more accessible format. We'll walk you through the steps and the considerations when you're setting up and using video consultation. We'll share with you the features with a short and simple demonstration of the tool. And of course, we'll answer any of your questions and share the resources that we have. We're going to do that right now with the link to the 5-minute overview video, which is on the Health Direct video call page. It's a really short, engaging and simple way to get an idea of how the tool works. Then there is the guidance available at the MBS Online website, the telehealth fact sheets. There's our new web page with information on all sorts of aspects of telehealth, and in particular video consultation. And there's a great webinar that was presented as a mastermind session, and it covers best practice appointment book management when you're using telehealth. And I really encourage you to watch that. That's about 30 minutes. So with all that said, I would just invite you to get in touch now if you have any questions. I thought there might be potentially questions on the Health Direct tool itself, the functions, the features, and how it compares to alternatives. Equipment and technology, you might have some questions about what you have or what you might need. Patient information and how to communicate and engage effectively with your patients, or perhaps training, education, and support. So if you want any more information on any of those topics, or you have a question about that or anything else, now is the time. So I'll hand back to Mel to facilitate the question time.
Thanks, Hannah. So we have had some questions come through. The first one is, can a clinician be in more than one session at a time?
No, they wouldn't be able to. They have one login, so they'll be able to be in one consultation at a time.
Okay, great. What does a video consultation cost?
Yeah, that's a great question. Unfortunately, I don't have the answer to that at the moment. They haven't released the costs at this point. However, Health Direct Video Call is a differently branded version of another product called CoView, which is currently available. And that and another one, which are both designed for the medical field in particular, cost between roughly $20 to $45 a month to use. So we imagine that the cost of Health Direct Video Call after the free period will be in the same ballpark.
Sure.
Yeah, I'm just thinking if there's anything else I can add to that. I think that's about all we know at this point.
Okay. What browser should I use?
Just referring to the slide I had up previously, it depends on what computer system you're using, really. So basically, iPhones and Macs use the Safari browser, and everything else pretty much uses Google Chrome. There's actually also on the Telehealth frequently asked questions page, there is information about how to work out what browser you're using and what version of it you're using as well. So it's worth keeping it up to date, and there's instructions there on how you can find that out.
Okay, and that leads us to the next question, which is what browser should I use?
Whichever one applies to you. Yeah, those two are the best ones to use. There is very detailed information for those who have a more complex setup, or maybe have an IT team who would want to work through this. There is actually very detailed technical information available on the Health Direct Video Call website. So if you do have, say, an IT manager or an IT provider, you can actually get them to look into that in great detail and make sure it's all compatible with your systems.
Great. Can I get a translator for my patient?
Yes, you absolutely can. You can get a translator through the translating and interpreting service, and again, the details are in the Telehealth frequently asked questions page. And that person is brought into the consultation as a third party. So as I said, you can have 5 different parties, and we tend to think of that as meaning 5 people, but it actually means 5 locations really, or 5 dial-ins. So you could have a translator on a video call with a patient on a video call and a doctor in a third place, and all 3 could be in separate locations. But you might also have the patient with a carer, so you have 4 people with 3 access points, if that makes sense. So when I do demonstrations, for example, I use the tool and I dial in as if I'm the practitioner, and the practice manager or the GP is on the other end, and sometimes they sit together. So there's one connection on each end, but there might be 3 or 4 people on their end.
Okay, thank you. Do patients need to consent to video consultation?
Yes, they should, because they need to understand and be prepared and able to do that. So you should ask them, yes, would they like to have that as an option, and do they have the capability? Yeah.
Here's a good one. What do I do if a patient gives me the hand signal?
There is a particular hand signal there's a hand signal that indicates that a person is experiencing domestic violence, and I think there is a link to that in the telehealth frequently asked questions. So if you are having a consultation, and I'm just trying to think, I think it's something like this. If you can see my hand.
Wow.
The tucking of the thumb and the folding over of the fingers, and it's important to be aware of. I don't know how widespread the use is or the awareness is, but it's important to be aware of, because that's one of the merits of not being just an audio only channel. You can see and observe things, and it may not be safe for a person to speak, but they might be able to indicate to you in that way that they are not okay.
Wow, that's amazing. I'm glad that question came in, because we do see people putting their hands up often in these sort of situations. So it's good to know the difference. So that's great, Hannah. Thank you.
I should have added, Mel, there's also, I believe there's also a link to some resources so that you know how to respond to that then, if that does occur during a consultation.
That's fantastic. Thanks, Hannah. How will patients know what rebates are available for the telehealth consultations?
I believe that the practitioners will need to tell them, and they'll need to source that information from the MBS online website. So I think from memory, we've also got that on the telehealth frequently asked questions page.
Okay, fantastic. Is my internet sufficient for video consultation? How do you know? How do you know if it's sufficient?
Probably the best thing to do, there's a website called Speed Test. I think it's .net, but again, refer to the frequently asked questions page. You can go there, and I suggest you just do this test, which takes about 20 seconds, at a time when you would ordinarily be thinking you could potentially be using video consultation. So if that's mid-morning when the practice is busy, then do this little test at around that time, and it will tell you sort of what the speed of your internet is. And I've also included then the information from Health Direct Video Call as to what is optimal for using that service. So you just need to you get a figure as an outcome of having done the speed test, and you need to check that that is at least as much as Health Direct needs to run.
Thank you. Does video consultation change how prescriptions are delivered to pharmacies?
No. So I understand that there's a variety of ways. Some people are still receiving written prescriptions. Others are getting them emailed or faxed or done through e-referrals, e-prescription and so on. But no, video consultation doesn't have any impact on that, so that it's no different to normal.
Thanks. What happens if I have a problem during the video consultation?
Well, it's good to talk about that before you get started. So maybe just tell your patient, look, if anything happens, we'll just try and reconnect. So I'll video call you back again. Or come back into the waiting room and reconnect that way. So you can just organise really whatever suits you. You might say, look, if this is really difficult, we'll switch to using telephone and so on. It's really between you and the patient to decide, but it's a good thing to briefly mention up front, just so that there's a contingency plan in place should anything go wrong. But what I'd recommend is just saying, look, if you're struggling with bandwidth and it doesn't seem to be working particularly well, just go out and come back into the waiting room again, and the doctor will pick you up again from the same location. You continue on.
So true. Where do I get help with the video consultation? I think you did cover that, but just to reinforce that one.
That's all right. There are plenty of options. So you can contact you can contact me at the PHN. You can contact Health Direct through their help desk. You can go onto their website and look at lots of resources, whether you want checklists or templates or patient guides or a short video. There is an abundance of material there that will help. And there's also obviously our own website, so plenty of information and resources available there.
Thanks. How am I remunerated for using the services via telehealth?
Okay, so that's detailed in the MBS telehealth items information. So that was on, I'll just go back a slide or two. In the fact sheets here on the left side under the red point, the guides, those fact sheets outline the remuneration, I believe.
Thanks. Will the PHN support Health Direct video call registration and setting up on an ongoing basis?
Yes, we intend to. So even after that initial period of a free trial is complete, as long as Health Direct allows us to do that, we will do that. So that just basically means that we provide a short form, your practice completes it and returns it, and all the administration and setup is done for you. It's usually done within a day, maybe 2 days at most, and we come back to you with it all set up and give you the okay to go, and then you can log in, and as the administrator you can change those things. So it might be anything from the hold music that people hear through to the automated messages they receive on arrival, or the opening and closing hours. So you can actually put your open and closing hours in the system, and it will close your waiting room if it's lunchtime, for example, or after hours. So all of that is able to be changed by an administrator, but we do the initial setup to get you off and running.
Thank you. And what are the risks of not offering the video consultation to patients?
Well, I think it goes back to the two key points I mentioned earlier. There is a risk that you potentially miss something. So if you're on a video call, a patient can give you a signal about domestic violence if they need to, or you might be able to observe on their face that they're not quite grasping what you're telling them. And you might determine that actually it's better if I send them some information that outlines it. Or in fact, one thing that I didn't mention is you can actually embed YouTube videos into Health Direct as well, so you can send those to a patient. So there might be a little video that you want to share with them that explains how to do something, or how to record some information, or even how something works for them. So all of that is just so much more easy when you can see and you've got the visual aspect as well as the audio aspect. So that's one thing. It's reducing your risk in that sense. You're less likely to miss something if you're doing the most close alternative to a face-to-face consultation. But the other thing is also that remembering that MBS guidance says that video consultation should be the first option. It's obviously covering yourself and managing risk from that perspective as well, that you're complying with that, and there's less risk by doing so than if you don't offer that service at all.
Yeah, for sure. Must I use Health Direct video call?
No, you don't have to. There are other systems that are used and designed for clinical and health type environments, so you don't have to, but the onus is on the provider to ensure that it's compliant. Whatever system they use is compliant with the Australian Information Commissioner guidelines. So that can take a fair bit of research and time to think and work through. So yes, certainly there are other options. There are paid options, there are free options, but it's probably good to talk to your PCIO or to me, and we can work through what are the merits of those and what are the risks. And essentially that spreadsheet that I mentioned that compares them all is really about risk management and risk mitigation. So knowing the level of risk that you're accepting for the product you choose to use.
Okay, so why offer a video consultation in preference to a telephone consultation? What's the benefit?
Hopefully I've covered that already. But yeah, I'd say in summary, greater ability to observe your patient, and compliance with your MBS online guidance.
Yeah, and I guess you get to visually have that, you know, be able to see your patient as well. So that's always a benefit. What's the benefit of video consultation for health professionals and for patients?
Well, hopefully you all recognise time, cost, convenience. As I mentioned, the potentially opening up to a wider range of patients across a greater geographic area, and just offering a greater, more flexible breadth of service to patients. Not everybody does find it easy to get to a GP, and not everything is able to be addressed over a telephone call. So this is sort of like the next best option. If you can't get there, this is a convenient way of still being able to have a consultation, and it's also more enriched than a telephone call will be.
Mel, can I jump in there? Thanks for that, Hannah. There's been a few questions also in the in a different part of the go-to section panel. So I'm just going to ask, do patients and clinicians need to be in Australia to be part of this? Really interesting question.
That is a great question. And I will say I don't believe so, but I would like to just double check and come back to that person if they're happy to leave their details.
Yep, no worries. We can get back to her. And there's a second one here. Do you have a template? Do you have a template for... Sorry?
You go, Kate.
Do you have a template for telehealth practice policy? For a telehealth practice policy? It's another really good question. So a template that a general practice could pick up and use to develop a policy.
No, I don't have that. I may be able to find one. So I will see what is available on the Health Direct website and any guidance that they give on that. And otherwise, again, I'm happy to come back to that person if I can take that on notice.
Mel, there's another question there that's just popped up. Can you see those questions?
Yes.
Or shall I just continue?
Yep, I'm just scrolling down. Okay, so so we've answered that it's available for overseas. Insurance does not cover us for consulting in another jurisdiction. So yeah.
Okay, so that's obviously going to be the most important factor. I believe that it may be accessible because you see you log in with an email and password, and I don't think there is any restriction on where you log in with that email and password, but there may be from an insurance perspective, absolutely. So
that's what this participant is saying.
I would recommend using it overseas.
Okay, so has anyone got any further questions? Please add them to the chat or the question box, and we'll respond to those. Just give you a couple of minutes before we're nearly at the end of the session. The presentation will be available also on our website, and a recording of this presentation will be available in Education Library through our website as well if you'd like to refer to it later. I think that's about it. Is any more there, Kate? I think that's about it. All good? I just want to say a huge thank you to Kate and for Hannah for this evening. It's been very informative. As a patient myself, I've used telehealth and really enjoyed the experience, and I'm getting a lot of amazing feedback from other people in regards to that as well. So I think it's really important, and tonight's been amazing. The questions and answers session was really good too. I think it's great to have that interactive component. So in conclusion, there will be a survey available that will pop up at the end of this session. Please complete that. We value your input. And a huge thank you to Hannah and Kate once again for this evening. And thank you to everyone out there for attending this evening, and we'll see you at our next session. Good night.